I'm Rubin. I'm studying MSc Biotechnology in VIT Vellore. Now I am discussing the topic Haemophilus influenza. The title of the content: Introductions, History, Disease, Causes, How to spread the people, Signs and symptoms and treatment and diagnosis and prevention of Haemophilus influenza. History. The Haemophilus influenza was first isolated by Robert Pfeiffer 1892. He also called as Pfeiffer bacillus. He thought infection agents of flu. He also called as Bacillus influenza. The common species three. There are three. One is Haemophilus influenza, and second is para influenza. Third is Haemophilus. Third one is Haemophilus duria. And now this okay. Introduction is Haemophilus influenza, one of the type of bacteria disease called Haemophilus influenza. Haemophilus influenza cause the disease cause the infections, ear infections, and mild with other like bloodstreaming infections are very serious. Haemophilus influenza does not causing a influenza flu. Vaccination can prevent one of the type of Haemophilus influenza. Haemophilus influenza have the vaccinations to prevent the bacterial disease. Epidemiology. There are three common species are there. The Haemophilus influenza, Haemophilus duria, and Haemophilus para influenza. Okay, that is our habitat and mode of transmission. Habitat mode of transmissions. Habitat is normal microbiota, URT. Mode of transmission endogenous, and Dorea non-normal microbiota, STDs, and para-influenza normal microbiota, endogenous. Mode of transmissions. Okay. This picture, the PPT. The picture: Haemophilus influenza causes nose and throat and spinal cord, brain and breaststream of infection. Haemophilus gram-negative, non-mortal, coco blalier and capnopiles pathological bacteria, the family of Pasteurlemia. The bacteria mosopiles or best at temperature between 35 and 37 degrees Celsius. These are the scientific classification. We know how the scientific names comes in bacteria. Binomial name Haemophilus influenza. Pathogens, Haemophilus influenza typing pathogen, typable, non-typable, encapsule, unencapsule, typable, two types, capsule polysaccharides and biochemical testis, capital polysaccharides, 6 stereotypes, A, B, C, D, E, F, and biochemical testis, biotypes 1 to 8. Non-typicable, H influenza, anti-HI, most infections and less more infections and less relevant. More infections and less relevant. Haemophilus influenza picture. Haemophilus influenza picture. These are the Haemophilus influenza pictures. There are gram-negative and non-motile, and Haemophilus influenza agar we used chocolate agar. Types of Haemophilus influenza infection. We know how the infections are come. Haemophilus influenza, this is one of the bacterial disease. The infections are causing ear infection, series of blood streams and infections. Doctor considers invasive disease. Invasive disease means easily to insert the people, germs freely to her body. And for example, Haemophilus influenza enter the fluid around the spleen and brain. That cause as a blood streams and invasive disease. Invasive disease is usually serious, requiring treatment in hospitals, but sometimes is death also. Results will be death also. And a common type of invasive disease caused by H influenza, pneumonia and bloodstream infections and throat pain and skin infection. These are the infections are there. And inflammation of joints also. These are the infections of Haemophilus influenza. Causes. What are the causes are they? Causes means easily the people who are easily to infected the Haemophilus influenza. It causes throat pain and nose pain. And Haemophilus influenza enter to the body parts. It sometimes get as a sickness. It is one of the symptoms few days before of Haemophilus influenza it can be appear. These are the disease infected Haemophilus influenza. How to spread the Haemophilus influenza? The spread, the people who are closely and lengthily contact with a person, he caused as a easily to spread and caused for Haemophilus influenza. And people who are infected Haemophilus influenza, they are affected coughing and sneezing of her body, and small respiratory droplets that containing bacteria. Small respiratory droplets are containing bacteria. And Haemophilus influenza is caused as a respiratory droplets. People at increasing risk. What are the people are increasing risk means some of the American Indian people, the child younger than 5 years old and adult 65 years are old, they are Alexan native people. It's certain medical conditions of increasing risk. What are the medical conditions? Sickle cell anemia, no spinal means that is spinal cord. No spinal means that is spinal cord. HIV infections and antibiotics, complement deficiency syndromes and cancer requiring treatment, chemotherapy, radiation therapy or bone marrow stem cell transplantations. Okay, what are the signs and next Haemophilus influenza symptoms and signs. Sign, that is Haemophilus influenza can cause many different kinds of infections. Haemophilus influenza can cause a different kind of infection throughout the bodies are infected. Pneumonia, fever and chill, cough, difficult to breathe, shortness of breathness, sweating, chest pain, head touches, muscle pain or itches, extensive tiredness. Okay, body steaming infections. There are commonly fever, chillness, extensive tiredness, pain in belly and nausea with or without vomiting, diarrhea, shortness of breath, difficult to breathe, mental status, and meningitis may have a fever, headache, chest and nausea or without vomiting. Photophobia means eyes become more sensitive to light and mental status. Babies or brain fever, that is meningitis means brain fever, that is brain fever. So babies with brain fever will be irritable, vomiting and feed poorly, appear to be slow in inactive, appear to be slow in inactive, have a abnormal have a abnormal relaxes. These are the babies for affecting symptoms of Haemophilus influenza. Okay, diagnosis or treatment, these are same. So diagnosis means okay, the doctor usually diagnoses for Haemophilus influenza. One or two laboratory tests are there. Now commonly test, okay, Haemophilus influenza commonly used methods for sampling of blood or spinal fluid. There are two testing methods are commonly used Haemophilus influenza. They are sampling of blood and sampling of spinal fluids. These are the diagnosis. And treatment, what are the treatments are there? Okay, people diagnosis with Haemophilus influenza take antibiotic to treat the infections. Treatment of Haemophilus influenza, the people to take the antibiotics to treat the infections of bacteria diseases. And another thing, breathing supporters and meditation for treat low blood pressure. Okay, meditation of treat low blood pressure and wound care of part of body and damaging skin. Treatment is Haemophilus influenza, one of the type of forming wound also knows that can be part of the body damaging skin also. So that also we want to cream, means we want to take the antibiotics to treat the infections of bacterial disease. And Haemophilus influenza called milder infections like bronchitis and ear infection, doctor maybe give antibiotic to prevent. Doctor maybe give antibiotic to prevent these complication of treatment Haemophilus influenza. Complication, what are the complications? Haemophilus influenza can result is long time problems or death only. Okay, Haemophilus influenza can result long times or many times or problems or death line of the Haemophilus influenza of bacteria diseases. And for example, brain fever have a brain damaging or hearing loss. That means brain mental confusion. So brain damage means that is mental confusion. Hearing losses, that is means not hearing for the people. That are the complications for Haemophilus influenza. And the last one is prevention. Prevention means from any antibiotics comes to enter any resistance or any other bacterial disease enter to our body to affect our body. Any bacterial disease or any other disease affected to our body, to prevent the time is called prevent that time we take any other antibiotics, any other tablets, that is called as prevention. So first of all, prevention is vaccinated. Now the Haemophilus influenza have the vaccinations in government organization. So Haemophilus influenza prevent HIV disease of prevent bacterial disease. Okay, vaccinations can prevent Haemophilus influenza HIV disease. Vaccination does not prevent disease caused by other types of other type means what I told, 3 common species, but only one vaccinations or prevent, only one vaccinations or disease can be caused, that is Haemophilus influenza. Re-injections Re-injection, people can get Haemophilus influenza more than once. People can get Haemophilus influenza more than get as previous HIV infection might not protect from future infections. Okay, pre-injection means previously HIV informations not protect from future infections. CD is recommendance. Okay, HIV vaccinations, even if sometimes someone's HIV disease imposed. Reinjection means the HIV infections not protected from the future infections. Preventive antibiotics, the people have Haemophilus influenza means it take antibiotics to treat the infections of infections of bacterial disease or any other disease. So we must take antibiotics to treat the infections of Haemophilus influenza or bacterial disease. So thank you so much. Thank you.